Hello, I'm Dr. Jennifer Ripley from Regent University, and I want to introduce our two presenters today, primary presenters Gayla Olvera and Imani Lipp, who are doctoral students, advanced doctoral students in the doctoral program in clinical psychology at Regent University. And they are part of the Hope Focused Counseling Lab here at Regent. And we have been focusing on the needs of minority couples. And we hope that you'll enjoy this presentation. We're going to be covering four primary areas in this presentation. One is issues broadly of diversity in couple therapy. Then we're going to specifically be talking about Latin couples and African American couples and go more in depth on their background needs and particular issues that sometimes come up when working with couples with that identity. And then some clinical strategies to be able to consider diversity when working with couples. All right, so first, general things about diversity and couple therapy. Diversity competency is, of course, a part of every mental health provider, and it's important for us to be aware of the needs of every couple that comes into our office. When couples are in a minority group, there's more risk that we might not be aware of some of the needs that they might have divergent or unusual needs compared to some other groups that people have worked with. And couple therapy adds some interesting kinds of complexities. For instance, anytime you put two people together, you're going to have diversity in the room in some way, whether that's gender, race, age, socioeconomic background, or even just interest and what to do on the weekends. So all of these things can play out in couple therapy. And then you add to it that couple is nested within an extended family of children, parents, aunts, uncles, cousins. And those people also have their own diversities. And so you can end up with a complex mosaic of diversity in the room whenever you're working with a couple or a family. One of the other things that's important in understanding diversity competency with couples in particular is that the relationship that a couple is engaging in and coming to seek help for can have widely varied meanings for different couples. So religiosity, for instance, can influence how people see their relationship. They might see it as more of a commitment, more of a vow or a covenant, if they have traditional religious views, for instance, whereas other couples may see their relationship quite differently from that. And so diversity is important, and race overlaps with that sometimes, as people often are part of religious groups that are racially influenced, right? There are not many, but few guideposts or rules for addressing the needs of Black and Latin couples in the literature. All couples have many overlapping and primarily the same kinds of needs, right? For all humans, everyone needs warmth, everyone needs support, everyone needs a safe harbor to go home to. And so there are not many things, but there are some things that we want to be aware of, and that's what we'll be covering in this particular presentation, particularly issues of risk and protective factors that are unique. All right. So Hispanic and Black populations in the United States collectively make up more than a quarter of the communities, almost a third of communities. And of course, local communities can have wildly different numbers than this, depending on where you live and where you're working. But it is a substantial part of the US population, and particularly the Latin population is a growing population. We're first going to spend a little time talking about Latin couples. There is not as much research on Latin couples as we would like. We would always love to have more research on this, but we're going to introduce to you a little bit. I'm going to introduce some, and then Gayla is going to talk some more about the research on Hispanic or Latin couples. So first of all, it's important to understand that Hispanic couples often face economic disparity, educational disparity, and judicial disparity. That these three things can actually compound on each other and create a situation where couples are facing a mountain of opposition or difficulty in life. Right? So if they have economic disparity, that means they don't have access to reliable income, and having their basic needs met can become difficult. And when people are in that frame of mind, of course, it's difficult for them to focus on enriching and growing and thriving when they're needing to survive. There's educational disparity as well that can happen. And so people don't have access to the education. And particularly if you also have low economic, then you might not be able to put your kids in schools that will provide everything that you would like them to have. And then we all know that the judicial system, we would like it to be blind, but it's not. And so the being caught by the judicial system, being prosecuted at higher levels, these things happen regularly with Hispanic or Latin couples. You add to that issues for many couples who are recently coming to the United States, issues in facing immigration and naturalization, the laws and regulations, or even if they are naturalized, that people assume that they're not, or make some assumptions and limit the amount of access to mental health care, medical care, educational opportunities, and job opportunities. We did find a little bit of research on urban residents correlating with domestic violence rates, so that would be specific to couples' needs, but we need more research on that. That's kind of a limited area of research. One of the things we have found in the research is as couples acculturate, meaning the more they take on the values of the dominant culture in the United States, they tend to begin to reflect majority culture more often. And so understanding acculturation rates, or even how partners might be acculturating at different rates and different family backgrounds for the two partners, would be an important aspect. Hispanic couples do report higher rates of relationship distress. And so wanting to think about maybe some of those disparities are one of the reasons for the distress, or maybe stress due to immigration, naturalization. What is maybe the cause of distress for this couple that you might see? Emotional expressivity may be more culturally normative. So there's some research that seems to show that people in Hispanic communities are more emotionally expressive. However, one of the great research findings of Gottman that has been established is that emotional expressivity is not related to relationship health. So whether you have someone who's quite stoic or someone who's quite expressive in the way they handle emotion in their relationship, it's not about that. It's about how they relate to each other in more complex ways. So extended family ties are often important in Latin couples, and those can be both a positive and a negative influence. So the research shows positive influence in terms of strength and support and extended network of family members who are supportive of the couple. But of course, if the extended family is not supportive of the couple, if they're divisive or there's concerns and they're pulling the couple apart, that can be powerful influence. There might be, maybe because of religious norms and kinship kind of norms, that making sacrifice for a marriage might be normative for some Latin couples. And when people have that belief, that tends to be protective of marriage relationships. So that's great if the relationship's going well. Of course, if you have a couple with domestic violence or very severe offenses where being together is unsafe, then that can become complex. Finally, familialism, so belief in the importance of family, the importance of kinship ties, and the importance of religion tend to be protective factors, and those tend to play out in Latin couples. So now Gayla is going to talk with us a little bit more about research on Latin couples.
Yeah, thank you, Dr. Ripley. So I'm just going to be talking a little bit more about thinking about the Latinx culture and what factors may be influencing couples that come into to clinics to get mental health services. So thinking about the Latinx population, generally most Latinx populations come from collectivistic cultures. And so this really ties into collectivistic versus individualistic cultures. The collectivistic culture really focuses on selflessness. So thinking about how the social roles are focusing on selflessness for the betterment of the group as a whole. Whereas an individualistic culture would think about being selfish and like wanting to do things for the betterment of the individual. And then also thinking about with collectivist cultures, the group focus. So thinking about the we culture and how the group and the community can come together to really thrive and succeed, which is different from the individualistic culture where things are more on a personal basis and more about I. Also thinking about what is best for the group. So often individuals from collectivistic cultures are going to think about what is best for my family, what is best for my community, not necessarily what's best for the person, just thinking about themselves, but really taking the time to think about what is going to be best for people around me in my culture. And so with this, it's important to also recognize the importance of families and communities as individuals from collectivistic cultures are highly dependent on their families and their larger community as sources of support. And so these are important factors to consider as you are working with diverse populations, but specifically with the Latinx culture, and thinking about how the collectivistic perspective can come into the therapy room. And so thinking about how the Latinx population receives psychological services, thinking about some of the particular barriers that they may face is important to think about as well. Particularly if, like Dr. Ripley said earlier, they may experience some language barriers, finding services in their language. And so also adjusting to a new language if they are coming to the United States, learning English, adapting to that can be very psychological distressing. And then also thinking about familial separation. So when individuals are separated from each other in the family unit, and thinking how this can be very detrimental to the family system and what kind of psychological impacts this can have on a couple, but as well as the family system and the community at large. And then also just taking the time to think about the financial strains of receiving help. Oftentimes, Latinx individuals will have a low wage employment. And because of this, this adds more to their psychological distress, which makes it more difficult to seek help because of the payment of services that are provided in mental health. And then also thinking about the unique anti-immigrant sentiment that is that can be found for Latinx individuals. So when acculturating and trying to fit into the dominant culture, they may experience unique discrimination as Latinx communities are still navigating this bicultural perspective of assimilating to the dominant culture, but then also holding on to their native and home communities and traditions there. And so this can create some tension and psychological distress for individuals. And so some other unique factors for Latinx couples, as we talked about before, familismo is really important in the Latinx culture because of the collectivist background. But what's really interesting in the research is that there are higher divorce rates for Latinx couples when compared to white counterparts. This is somewhat due to the lack of resources that they may have to seek couples counseling or mental health services in general. But then also thinking about the additional factors that come into the relationship that white counterparts don't necessarily have to face, such as discrimination, such as acculturation issues. And so this is a very unique factor to consider when working with Latinx couples and how this may show up in the room. Additionally, there are higher rates of relationship problems in the child rearing stage. So then thinking about, again, the family systems model and how individuals and couples who maybe have immigrated here or don't have the same sources of support as other people would, such as like grandparents or extended family around. If they are newly immigrated, they don't have as many supports. And so this can cause relationship strains in their child rearing and development. And so thinking about the Latinx culture and how this influences their mental health views, kind of touched a little bit on this, but typically what the research suggests is that families of Latinx background resort to going to the emergency room as a last getaway for getting help for mental health services. So essentially they wait until it's a really bright red light, things are really bad, and this is the only way they can really get help. And so this also kind of ties into the idea that these conversations about mental health are not really welcomed or really talked about in the mental health community in the Latinx culture and are seen as taboo. And so this hush-hush culture is really detrimental for people who want to seek help but don't feel like they can because of that collectivistic culture and those values that go along with that. Also, as Dr. Ripley mentioned earlier, these unique religiosity backgrounds can come into play. And so if a lot of Latinx cultures have Roman Catholic backgrounds, and so their religiosity beliefs and their faith beliefs can intervene on how they view mental health and may not want to seek help because of their ties to God. And so thinking about those unique perspectives as people are coming into your office are going to be really important. Also, there is a negative stigma in the Latinx culture, thinking about how if someone is diagnosed with a mental health disorder, this could bring shame. This could bring dysfunction to the family system and the larger community. Thinking about what could this mean for my family? What could this mean for how people at church, people in the community view us as a family? And so thinking about how all of these influences are going to be really important as you start working with diverse communities and populations, but specifically with Latinx couples. And now I'm going to pass it over to Imani.
Mm-hmm. Actually, I'm going to talk for just a minute, sorry. And then Imani's going to pick it up from there. So just as a bit of introduction for some of the research that I found on Black and African American couples. So we're not going to deep dive into that, and then Imani's going to take it from there. So similarly to Latin couples, there is race-based stress for Black citizens, many of whom are in couple relationships. So you again have economic, educational, and judicial disparity, for which there's been a good deal of research in sociological and legal research areas that definitely show that access to the good stuff, the high shelf, the good lawyers, all of those things can be differential for Black citizens. One of the other things that's unique within the African American community is low marriage rate and high divorce rates. This has led to a lot of controversy. And so we want to make sure that we are being respectful and careful in the way we think through this issue about the sociological and external causes that can be influencing, right? How people have a hard time finding a marriageable mate, for instance, due to high economic, educational, and judicial disparity can really influence that. And that the disparity has been particularly difficult on African American males, making it difficult for African Americans to form couple relationships. So there's some discussion about marriage not being necessary, but there's some economic realities for that, for people in the lowest strata, in poverty communities particularly, or homes where poverty is in play, that there can be some things that are barriers to establishing marriage, buying a home, and being able to kind of achieve the American dream of a happy marriage together. There's competition for marriageable mates, particularly men. I know one of the things we've heard in our clinic from women is that, kind of marriageable African-American men get kind of offers for, relationships that are illicit, and there's kind of a sense of tension around that sometimes, and there's some sociological reality for those in the dating pool. And so being thoughtful and careful about that, and that this is a reality that some couples are facing, and they may particularly feel that tension that, I need to make this work because there's no one else for me, but maybe my spouse has options. So you have that happen, and particularly because of some of these disparities, people in groups where there is a lot of just like economic, educational, and judicial disparity will have a tendency to marry across other social strata. And so you may find people married who are from different socioeconomic, different religious groups, different age groups, that sort of thing, and they're more acceptance of that. So there's some strengths there in people finding a good partner for themselves. But also we have to watch our own prejudice, right, against maybe people who are married who are at different ages or different religious traditions, that sort of thing, because they may be working with a small pool of marriageable mates to choose from. These threats can sometimes increase because there are many more women than men that are in a financial and life circumstance where they're marriageable. And this affects the church too. There's some research even in Christianity Today has published some research talking about how there are many more women at marriageable age in the church than men, and this is across all racial groups, but particularly for African-American churches. And so you might want to listen to that from a couple, like it might affect their ability to make friends with other couples, right, and have other couple friends. And so they may frequently have kind of a variety of friends in their life, in their circle. One of the things that's happened in our culture is that Black women have been promoted in the workplace more advanced and longer than Black men in particular. There's a gender intersection difference there, making it common for Black women to be in a higher status and higher income level in the workplace. So there's some research on that, and that this can play out in the couple relationship and helping them to find acceptance if the woman is being promoted, but the man is not in that particular couple, and what that means for them and how to show respect and care for both partners, regardless of discrimination that they might be facing in their workplace or in their community, and helping them find that safe harbor. Finally, it's really important to always remember that every community has its protective factors and its strengths. So the African-American community has a long tradition of spiritual support and really inclusivity in the Black church, and that people are welcome in, even if they don't kind of fit in, even if they're a little bit different, that there is some acceptance and support, financial support, as well as practical support within the Black church particularly, and also in extended Black families. And there's a long tradition of positive racial identity among so many Black families. And so being able to draw from that as a place to build safe harbor can help a couple, a Black or African-American couple, to be able to use their sense of self and their sense of positive racial identity as a way to build a sense of positive couple identity, even if they're two different races in the couple, but that they can learn about their race, learn about the history, and have a sense of pride. All right, so now we will be hearing from Imani about African-American couples.
Thanks, Dr. Ripley. So when we look at African-American couples, they definitely have a series of strengths that can be drawn on when offering couples therapy to them. So among these are egalitarian roles, their sense of community, and as Dr. Ripley was saying, their sense of religion. There's a flexibility in the gender roles of the home. So for example, if both partners are out working, that means both partners come home and they clean the house, or they cook the food, or they share in the child rearing, because that is what has to be done in that sense. And it shows that for African American couples, when they are sharing in those egalitarian views, as opposed to the majority view of, the man is the provider and the woman is the home caretaker. When they share in those egalitarian views, they have a happier marriage than suppose the inverse of sort of buying into that more dominant belief. For their sense of community, there are going to be very close sense of family and friend ties, trusted elders in their community who they're going to turn to for wise help. So couples may be more likely to turn to successful married couples that they know of who are older, who have been through it, maybe more likely than they would turn to a therapist role. And then again, with those religious ties, they're going to have a strong sense of community in their religious groups. So the African American churches might have some resources when funds are low, or when trying to find a job gets difficult. The church is actually going to be able to step in and provide those resources to them and be that sense of safety and trust that these African American couples would be looking into. They can also find coping skills and support it for their relationships by turning to sometimes some of these programs that the church might offer for couples in order to help them work through what they're going through. So one thing to keep in mind with African American couples is that their family makeup might not look like the regular nuclear family. Yes, you might have the mom or the dad, some kids, but there's also in-laws who might live in the house. There could be multi-generational homes where maybe it's the grandparents and the parents and the kids and then the kids of those kids. You could also have those blended families, step-parents, step-grandparents also living in the home. And then I put in quotation marks aunties, uncles, and cousins, because these could actually be friends of the family, but they have such close friend ties as best friends of parents or grandparents that after a while they've become enmeshed into the family as well. So they could be considered like auntie as a form of respect, as opposed to saying Mr. or Mrs. So some of these strengths also, there could be hardships as well that you might see commonly with African American couples. One of those is going to be racism or unfairness outside of the home. There is a systemic situation of racism that African Americans and Latinx people face out in our country. And the frustration and the hopelessness feelings that people may feel when they are out in the world has a tendency to come back home with them. So for example, if somebody is frustrated with the unfairness that they are suffering from outside, when they come into their home, there might be an expectation of fairness in the home, but it may not technically be voiced or understood. So being aware that fairness might be a value that is being put underneath the foundation of their relationship that maybe one partner or the other didn't realize is going to be one way to notice how racism might come back home with them. There's also a lack of resources out there for African American couples. Now, this could pertain to finances, not having enough money to pay for things that need to be paid for or done, but those finances, they fall into almost every other category. So that could be they don't have reliable transportation. It could be they don't have reliable medical situations. It could be the fact that it's hard to find a job and they can't bring finances into the home to take care of all those other things that I just listed. Also in there could be living in neighborhoods that don't have the best school systems, I think this was already said earlier, and how these school systems are lacking the finances and the abilities to teach the children what needs to be taught, or to take care of the children as needs to be done as they're moving forward in their lives. There's also a lack of resources for marital help, community-based marital help. If this resource exists, maybe the couples aren't aware that it is out, if it's not in line with the church or being, shown to them in some way or another. And then you have those outside stressors. Again, I mentioned not being able to find work, or the outside stressors of not being able to find reliable childcare, which also plays into finances as well. If you can't find somebody to watch your children, you can't go to work or come to couples therapy. There could be family or community drama that could also be playing into their relationship. Again, if their household kind of looks a little bit different, there may be other opinions, other views, other aspects that are going to be playing into the marriage relationship that has some negative connotations to what's actually going on. And of course, during this time, we still have a roaring pandemic, and there are still individuals who are being unfairly missed out and who are dying from the COVID-19 in African American and Latinx cultures as well, due to lack of understanding or vaccinations. One of the aspects that researchers do at all noticed, they were looking at how racism or maybe even finances could interplay and cause spillover into their marital happiness. And what do et al. Actually found was that couples who were experiencing racism had a likelihood to feel more connected in their relationship than the couples who had more financial disagreements in their life. So in a sense, this is a solvable versus unsolvable problem. Racism can't be solved by a couple alone in the world, so it's more like coping through it, working together through it, making sure each other feels safe or have that fairness in their home while dealing with the racism of the outside world. Whereas finances seems like it should be a problem that you could just buckle down and solve, but oftentimes it's actually not. And so the conflicts come into play when those financial issues aren't being solved the way they assume it should be solved. So for this one, it's kind of like why African Americans may or most likely may not come into therapy for their relationship. To begin with, there is some serious stigma between African American community and the medical community. There's stigma behind psychology, where they think that therapy is only for crazy people and they don't want to go there because they're not crazy and they don't want other people to think that they're crazy. There's also a tendency for the television in Hollywood to show negative depictions of therapy and therapists, psychologists in these low lights. And for some people, this is their only experience or exposure to what therapy, what psychology looks like. So with more of these negative portrayals on the television screen, it's likely that people will believe into that and buy into that because they haven't seen it before. There's also, again, that lack of trust because of the medical field and because of the previous transgressions, like the Tuskegee syphilis research that had been done. And these stories have been passed down, and African American people know about what happened during these times. And so it causes a general distrust for anyone in a white coat, basically, not having their best interests at heart. And then there's other reasons why African American couples may not be interested in going to couples therapy. They might believe that the therapist doesn't know what they're talking about or doesn't understand the hardships that they go through, the couple goes through, in order to even offer help to begin with. So on a sense, it's like they don't have any street cred about what they're living through and about what they're going through. And so how can you help me when you don't even understand where I am at this moment? And they might also think that therapists are hypocrites. They might believe that they are offering help and information and interventions that they themselves don't actually use. So those are kind of things that as therapists, as couples therapists, we would keep in mind when working with these couples and realizing that they kind of overcame a whole lot of different things in order to come here for help.
Sorry about that. My mouse just had feelings.
Yeah.
So thank you, Imani, for that review and very clinically applicable aspect of the science. So we're switching now to a section we're going to be talking about actually doing clinical work with culturally different couples and some things that we want to be mindful of as clinicians. So to start out with, one of the things to remember is that all clinicians need to do the work before the work, meaning the importance of us to be able to understand our own biases, our experiences, the impact of racism and the culture, family, and communities that we're a part of, and how to take an empathic stance. So biases is around being aware of them. Couples will notice when we have a bias, and it can cause damage and rifts in a therapeutic relationship. And so even being rough around the edges and the way that we communicate around things like diversity aspects or personal experiences or financial issues can really help a lot in understanding things. So there can be rifts in therapeutic language if we are not aware and comfortable and knowledgeable. And it's important for us to be able to work through those things before we begin working with a couple who is different than us. Now, once in a while, someone will show up that you just have never had exposure to, right? And maybe in some unusual kind of community, maybe they are, recently immigrated from Madagascar or something, and that's just a new community to you. And so, when that happens, then we want to consult on that type of a case and get some input from someone who's more knowledgeable. And it's useful to regularly consult on culturally different couples because clinicians can drift and think we know things that we don't actually know. The second thing that we want to do as work before the work is to understand systemic aspects of racism. Racism affects individuals, but it also affects schools, neighborhoods, communities. It affects most any institution can be affected where people are not intentionally doing kind of old school racism, right? And kind of intentionally having rules or policies that are intentionally harming, but they have implicit or modern racism or systemic kinds of things. For instance, you might have something like people get together after work and they sometimes talk about work, and people who are in minority groups or divergent groups are not included in the after work conversations. And that's one way that systemic racism can occur that is just due to a lack of attention and priorities from everyone in the community. And so being aware of that and what kind of ways that might play out in the lives of clients who are facing systemic racism in their lives. Third is to think about how do you do empathic stance and joining. So Kelly and Nancy Boyd Franklin call it joining, which is a really great word. And it's creating a stance of understanding with the couple and a radical acceptance of their experience, gaining their trust by being with them in the room. So this can be everything from, just their beliefs about the future, right? But it can also be around issues directly around racism, sexism, or community disparities. And that their experience is their experience, and being able to take that seriously and trust them that they have a good understanding of their own lives. Now, I'm going to talk just for a few minutes about the hope focus approach, and then we're going to get back into talking about working with couples. So a lot of what we have learned is through the Hope Focused Couples Lab here at Regent University. So the Hope Focused approach was created originally by Dr. Everett Worthington at Virginia Commonwealth University, and then I joined him in the 90s and have worked with him in developing it. It has emotional behavioral solutions and strategic approaches to therapy. It is inclusive of religious interventions. The approach tends to be brief, which works well, particularly if you're looking at working with couples with limited resources, to kind of have like an 8 to 10 sessions as a general starting point. And then some people may need more time if they have more needs. That it has many interventions and it's a strength-based care. And we think that's a particularly good approach when working with couples from Latin or Black communities, that drawing on strengths can be a great way to build a joining relationship and also to counteract some of the racism that exists in our culture. And then if the clinician can be culturally competent and continue to always be developing their competence, then we think that the Hope Focused approach is a good way to be able to do culturally competent couple therapy. Okay, I'm going to pass it off now. I think Imani is next.
So when looking at interventions that have taken the attempt to target low-income minority couples, we have a few here, like Building Strong Families, Supporting Healthy Marriages, and the Our Relationships program. Across the board, these programs were targeted towards those low-income minority couples to offer couples workshops to them and to help with their relationship management. So for the Building Strong Families, about 54% of them were African American or Latinx. However, there was little to no effect on preventing the divorce or helping with their marital satisfaction. And even when they looked again at about 15 months, there was no difference in that treatment or control. Versus treatment or control. For the Supporting Healthy Marriages, they again had those very similar results. Very small positive relationship effects after the workshops or the education. And then the Our Relationship program is finding some improvements by targeting through online care Hispanic and rural couples that might have been ignored before. And there was some increase for their perceived health. But again, those relationship increases were very, very low, almost next to nothing. So it kind of shows that the research is showing some more focus and interest on working on these couples and reaching out to them. However, the normalized aspects that people are using for couples therapy isn't actually helping or working with these populations. And so there needs to be more research and a more focused approach about how we can change how we're reaching these people and help them through what they're going through so that they have more marital satisfaction in the end. So some interventions that we use in the Hope Focused program is there are screeners questions that we ask. Some of the questions that we like to ask is the miracle question, which is actually the solution focused question. And then another that's about how they imagine their relationship would be if a miracle happened and it was exactly what they wanted. Another question would be, is there anything about insert aspect here I should know as part of your improvement plans? So this sort of gives the therapist the space to ask more about any cultural differences that the therapist might have questions about, or allows the clients in the room to offer more information or an aspect that they want to improve on their relationship. Also during the intake, we ask them about what aspects of their identity do they find most important to them and how that might play into their relationship as a couple, or how their different cultural backgrounds could impact the relationship as they are together. A few of the interventions that we can use during the sessions would be family of origin or the vision statement. Family of origin kind of breaks down how through the generations their relationships looked like that were modeled for them. So are their grandparents still together? Are their parents still together? What did it look like when you were a kid growing up in your house versus maybe how did you expect your family to look at like now in this moment in time, and how are you modeling after that? Sometimes one partner or the other might have very different views on what a family is supposed to look like. So including this in the intervention and in the sessions gives those couples that space so they can talk about these differences. And again, that goes into the vision statement where the couple works together to talk about what they want their relationship to look like, their family to look like, their goals to look like, after they have an understanding of where their partner's coming from the family of origin. So this is an intervention that I kind of created. It was in the midst of the George Floyd incident and during Black Lives Matter. I created this intervention to help couples express when racial hurts and experiences have happened to them. So the acronym is called Sadie, and Sadie stands for share, accept, discuss, empower now, and empower later. So the one partner shares, so the sharing partner talks about what happened, the listening partner listens, and then they work together to accept what happened to them. So the sharing partner accepts what happens, the listening partner validates it. They talk about what they're feeling in that moment. They share their feelings and then they accept. However you feel in that moment, it's how you feel. They discuss if this has happened to either of them before, and maybe think about, what did they notice on the inside? Was this similar to previous incidences that have happened? Maybe how other people reacted in similar situations to sort of get that feedback loop. And then for Empower Now, they kind of, I call it empowerment, but it really is just self-care, so that you can feel like you have some control over your own life and over your own experiences. And you can decide if that is a self-care incident, like a by yourself bubble bath to sort of feel better, or an us care sort of situation. Maybe you both go out to eat or spend some time together, watch a movie, things like that as a couple. And then for the Empower Later, that's going to be resistance or civil disobedience. So the sharing partner decides if being an activist is something that they would want to do, or if they want to go to protests, if they want to talk to HR about the situation, if they want to donate to other programs. Empowering Later is more like a way to get involved and sort of put those energies, maybe that anger that you have, in a positive output so that you can get a better outcome later.
Yeah, thank you for sharing, Imani. And so now we're going to be talking a little bit more about what you guys can do and what are some clinical implications of what we shared today. And so when you are working with diverse couples, it's important to have all of those factors that we've shared so far in the presentation, but then also to think about the strengths that come with a couple. As Dr. Ripley mentioned, the hope-focused approach is really focused on highlighting those strengths for the couple so they can have that hope instilled in them. And so if you are seeing and working with diverse couples, it's going to be really essential to view the strengths of the couple and highlight that and incorporate it in treatment. And then also, as we said so far in the presentation, we want to be culturally sensitive. So being mindful of the cultural factors that influence Latinx and Black couples, and what that kind of shows up in the room. This could be resistance to engaging in conversations. You might encounter maybe some countertransference, and you might want to explore that and what that's like, or maybe even thinking about if they are canceling, where could this possibly come from? Is this something that they're uncomfortable with because of their family systems? Just having these cultural variables in mind is going to be important. And then also thinking about the therapeutic alliance. So continuing to have that warm and empathetic response is going to be essential, especially when working with diverse couples, because we want to not perpetuate their negative views or negative experiences with mental health services. And so having that warm and empathetic and welcoming response is going to be helpful for that therapeutic alliance. And then also for treatment planning, when thinking about the interventions that you're going to be using, to think about the family systems model and continuing to think about what other resources that can be helpful for the couple. So if they are religiously affiliated, thinking about how they can get connected with church and maybe some church services or pastoral care if they wanted to supplement that with couples therapy, or if they wanted to do direct Christian integration, you could also influence that and incorporate that into treatment planning, and really making sure to highlight those strengths is going to be really important. And so now we're going to allow you guys to kind of explore what to do with a case study and to kind of implement some of the things that we've talked about today. So this is a case study. We have a client called Maria Lopez. She is 30. Her ethnicity, she is Cuban American and she's Hispanic. She is premarital, so her and her partner are engaged. She is female. She identifies as Christian and she's heterosexual. And her nation of origin is from Cuba. Then we have John Williams. He is 35. He is a male who is African American. He's also heterosexual. And he's also premarital, so engaged to Maria, and his nation of origin is in America. And so they are coming into the clinic to see you, and they are seeking couples counseling to address issues with communication and navigating their family conflicts. Specifically, they want to address how to handle the family conflicts since they are going to be getting married. Their families don't seem to get along. Their cultures are conflicting as, one side is not Christian, but the other side is. And so they're coming in to learn how to navigate that, and then also the views of them being from two different cultural backgrounds. And so they want to learn some skills to navigate this along with communication and conflict resolution as they prepare to get married. And so we're going to pause here and let you guys go ahead and discuss. And then if you have any questions, you can touch base with us.